there was a point in the pandemic where they talk about the changing face of the AIDS pandemic. And that always made me crazy because the face of AIDS didn't change. No, white people in the media finally got the memo. People started to look at the data. We were always there. We were always disproportionately impacted by the pandemic. In the very, very beginning, 25% of new cases were Black. That information was not reported in real time. It allowed us to have the misconception that this is not our problem. It slowed down a response in Black communities that allowed HIV and AIDS to take a foothold that did not need to happen. I've lived my entire adult life, quite frankly, with HIV and AIDS. In 1981, my partner, Chris Brownlee, discovered that he had swollen lymph nodes. And I discovered that I had swollen lymph nodes as well. And we went to the doctor, and the doctor was talking about something that he had heard about swollen lymph nodes in gay men. Eventually, Chris was diagnosed with full-blown AIDS. In 1985, maybe 86, they came out with the first diagnostic test for HIV. And I soon took the test. The results came back in, and I was told that I was positive, and I was told that I should go and get my affairs in order, and that I probably had 6 months to a year to live. And I remember this flood of thoughts coming in. And one of them was, I am 28 years old or so. I don't have any affairs to get in order. And I remember thinking, the death and dying is going to take care of itself. That it doesn't need my help. That what I need to do is to focus on taking care of Chris, focus on the living, because that was something that I could do. Today, that continues to be true. That the dying continues to take care of itself. We need to invest our energy in the living. Every organization I've worked in, every institution I founded, has always been about understanding the devastation that accompanies that information around one's HIV status, no matter how prepared you think you might be. And being sensitive to that reality, but also to focus on the living. As long as there was life there, it deserved to have dignity. And that notion around the dignity of life and the dignity of the human experience and the dignity of human beings is something that I've tried to incorporate in all of my work. My grandmother used to say, when white people get a cold, Black people get pneumonia. And so I thought, if white people are getting the plague, what in the hell are we going to get? And so there were Black activists involved from the very beginning. There were Black activists involved in ACT UP. There were Black activists involved in the early institutions of the epidemic. There are those of us who are working in Black spaces, and those spaces that we were working in that were addressing the needs of Black people were not being recognized and are not being recognized to the same degree as the work that was being done in other communities. You could go across the country and look at Black activism that was not making it to NBC or any of the news or the front page of the New York Times. That reality continues today. Now, when you look at the history that is now being reported about the AIDS pandemic as we commemorate 40 years, so much of that history is erasing our story, but we were there. We founded the Black AIDS Institute in 1999. The precursor to the Black AIDS Institute for me was the Black Gay and Lesbian Leadership Forum, and kind of the precursor to that was the National Task Force on AIDS Prevention, and it was the first organization to really say unapologetically that we're going to focus on gay men of color. The Black Gay and Lesbian Leadership Forum followed up by saying that if we're going to deal with HIV and AIDS in a Black queer space, we have to deal with the larger social issues. And then the Black AIDS Institute really was an effort to focus on the science of HIV and AIDS, because we believe that if people understood the science of HIV, they would be more likely to protect themselves. They would be more capable in responding to the AIDS epidemic. They would be more likely to seek treatment. And they would have a greater understanding and a greater voice to influence policy. What we know about social issues, in particular health issues with a social component like HIV and AIDS, is that the message matters and the messenger matters. Who communicates those messages has a huge impact on how people react to the message. And who decides what messages need to be communicated have an impact. And so what happened with HIV and AIDS, since the messenger was hardly ever Black, since the message was not designed by Black people for Black people, now, by definition, it was a message that was not going to resonate with us. In our communities, unless we are explicitly included, we are implicitly excluded. And then to exacerbate that, the rationale for the rise in cases in Black communities were characterized as being based on homophobia. Or our behaviors were pathologized. Why can't Black people get the message? Black churches have been critical institutions in Black communities for a long, long time, probably from the very, very beginning of our presence here in the United States. With the onset of the HIV/AIDS pandemic, those churches were initially left out. Then the information those churches received was flawed information. Once we're really able to establish the truth of what HIV and AIDS was and what it meant to Black communities, there were a huge number of examples of where Black churches rose to the occasion. There are more than a few examples, of course, where Black churches failed to respond to the AIDS epidemic, just like white evangelicals, just like the Catholic Church, just like some Jewish institutions, And what's interesting to me is that there is no narrative around how did those institutions fail in the fight against HIV and AIDS, but there's an overwhelming narrative around how Black churches failed. Now, and that is a part of the larger dialogue on how Black communities, our institutions, are addressed in a different way than other racial ethnic groups and those institutions. Medical mistrust is very real in Black and marginalized communities. Unfortunately, as with many things, people want to simplify it. The truth of the matter is that medical mistrust is a part of a larger problem around institutional mistrust, which exists and is justified by the way the institutions treat us. So medical mistrust is connected to police brutality. Medical mistrust is connected to redlining. Medical mistrust is connected to voter suppression. All these areas that when given an opportunity, to do right by us, when given an opportunity to be just, our society overwhelmingly chooses otherwise. The lessons that we should have learned around race and racism and access and message and messaging, through the HIV/AIDS pandemic, clearly we have not learned, because those same issues are showing up again with COVID-19. When people ask me, when did I decide I was going to live? I don't think I ever made that decision. Connie Norman used to talk about taking it a day at a time. And when the days get to be too much, to take it an hour at a time. And when you don't believe you can make it to the top of the hour, take it a minute at a time. And I keep stringing along those minutes. To do otherwise is to be disrespectful of my friends and loved ones who didn't get as much time as I have gotten. They mattered, and because they mattered, I have to believe that I matter. And I need to honor that life to the very end, whenever that might be.